The more of a reality the COVID vaccine has become, the fewer number of people want it. Those surprising results were published in the Journal of the American Medical Association. Of those surveyed last April, 74% said they were somewhat or very likely to get the vaccine. But there was a big drop when the same question was posed in late November, when the vaccine was starting to become available. That number plummeted to 56% of adults who planned to get the vaccine when their time came. So we wanted to hear why and decided to host a COVID-19 vaccine roundtable that would represent some of those voices here in southern Colorado. Here's what our neighbors are saying about the vaccine and what doctors are saying in response.
In this building, the Colorado Springs Pioneers Museum, decisions have defined our history. And once again, we find ourselves deciding a pivotal, historic time. We gathered 4 people, a sampling that represents the split opinions on getting the COVID-19 vaccine.
My name is Neva Martinez Ortega, and I intend on getting the vaccine.
I'm Rob Allen, and I've already got the first round of the vaccine.
I'm Linda Baker, and at this point, I'm not going to get the vaccine.
My name is Don Courier, and right now my idea is not to get the vaccine.
All 4 have their reasons.
Rob, let's start with you. Get us inside your reasoning.
It's a precaution. I mean, I don't mind being a test bed, so I decided to get the shot because of what I do for a living. I've had a friend who passed away. He was the deputy. That kind of like, whoa, okay, if it could happen to him, maybe it could happen to me.
El Paso County Deputy Jeff Hopkins was one of the first to die in the Pikes Peak region to COVID. Seeing firsthand COVID's devastating effects was also a motivating factor for Neva Martinez Ortega. Her mother, Rita Martinez, was a well-known activist in Pueblo.
She passed December 10th, which was just 2 or 3 days to the vaccines arriving in Pueblo, Colorado. That was really heartbreaking, you know, to think that we were so close to getting a possible way out of this.
And yet treatment of some minority groups by the government and medical community has been inhumane, causing many to distrust health care in general.
The track record has not been great. In fact, it's been frankly shameful with many populations. And so was there a tug of war at all inside your decision process?
I still feel conflicted about taking the vaccine. I can understand how, you know, communities of color, again, have that mistrust from the medical field and from the government. There's been, you know, a lot of different things throughout history that has led to that point of feeling that mistrust, and I still feel that. But again, I've seen what life is like with COVID and how that has affected my community, how that has affected my family. And so right now I feel kind of trapped into a decision of that's really the only answer that I can see for right now.
Neva is right. Communities of color are twice as likely to die from COVID as white Americans. Others, though, are not fully convinced that getting the vaccine is safe.
I'm very torn on this. Do you give it to somebody with multiple issues or somebody that's a little better on the health side? I don't even know how long the medication is going to hold up. Right now we're looking at what? Something that's been going on for 9, 10, 12 months?
Would it be accurate to say you're waiting maybe for more time to elapse?
Yeah, 10 or 15 years.
Linda says that until she knows more, she'll keep to social distancing.
It's almost like you've kind of isolated yourself to Siberia, which you don't want to do. I think I have all the Clorox wipes and sanitation stuff in the world.
And for Don, he's had an adverse reaction to getting the flu shot. He got Guillain-Barré syndrome.
And it's just a constant tingling, like your hand's asleep.
So have you gotten a flu shot since?
No, she advised me once I had the Guillain-Barré and the flu shot, she said you probably shouldn't get another flu shot. I'm not against it per se, but I'm not sure. I want to make sure they have more testing on it.
We took some of these questions to Dr. Megan Michaz, who specializes in allergies and immunology.
We have a vaccine that was tested on tens of thousands of people and found to be very safe.
Where vaccines usually employ anywhere from 3,000 to 6,000 volunteers for phase 3 trials, Pfizer enlisted the help of more than 40,000 volunteers. Moderna, 30,000 volunteers. In those trials, the vaccines were shown to have a 95% efficacy rate, according to the CDC. And according to Dr. Mishaz, the technology has been in development for years.
The mRNA platform, although it seems brand new, it's really been in development for well over a decade. COVID just happened, fortunately, to be a virus that it would work for.
But there are people who shouldn't get the vaccine. Those who have an allergy to polyethylene glycol, which is a common component in laxatives. Also, those undergoing chemotherapy or on other immunosuppressants need to talk with their doctor first. Pregnant women also need to talk with their doctors. And there have been instances of reactions after the vaccine.
People can get hives from both an allergic reaction as well as an immune response. You can also get hives over the injection site, which in some cases can even be delayed. That's actually the immune cells coming to the injection site and really doing their job.
But by and large, Dr. Mishaz says the vaccine is safe and effective.
So if you do get the vaccine, common side effects include fatigue and joint pain. Those should be temporary, however. Experts estimate that between 70 and 90% of the population needs to be vaccinated to reach that herd immunity. I've posted additional information from my interview with Dr. Mishaz about the vaccine over at krdo.com.
It's easy to hear somebody say, I don't want the vaccine, and go, what in the world, why? But when you hear them explain it, you've got some decent concerns with the risk versus the benefit.
Adverse reactions maybe, or just skepticism. How could something like this have been developed so quickly?
Pretty eye-opening.